Assalamualaikum warahmatullahi wabarakatuh. My name is Rezmha Aurellianty with the 061 Today I want to present the concept with the topic is cost minimization analysis or CFA. Okay, so here's the article that I used. The title is cost minimization analysis of metformin and carbon in treatment of carbon diabetes. Okay, so my first question is what will be cost and response? The answer is yes. We can see from the background objective and also the thought that metformin is the first one oral hypoglycemic agent for type 2 diabetes mellitus per international guideline with approximately 60 and also cost effectiveness. And effectiveness of metformin and glucose to extensively absorb the genetic and perspective itself by the player's perspective. Okay, next for the second question was a comprehensive description of the complexity of repetitive for example like community of rigid syndrome, there are all ones, so the answer is yes, why because that also that there is not only a patient quality of life but also bring a heavy economic burden to both of the family and the society. And also type 2 diabetes account for at least like 90% of all cases of diabetes and it was reaching the $26 billion in 2007 in direct medical costs and also predicted to be $47.2 billion for 2055. And it shows that the drug of metformin is the first one of oral hyperglycemic agent for type 2 diabetes mellitus. And it proven that efficacy, safety, and also cost effectiveness. Whereas the acarbose is the second one of drug in treatment of type 2 diabetes in China. Okay, third question was the effectiveness of the program or service established. The answer is yes, since the metformin appears to provide better value for the money than does the acarbose. Metformin is undoubtedly for the first choice in management of type 2 diabetes mellitus with the significant glucose lowering effect and low treatment costs. Next question, were all the important and relevant costs and consequences for each alternative identified? The answer is yes. From the title is by meta-analysis, by indirect comparison, and also indirect comparison. It means that glucose lowering effect of metformin monotherapy are at least as good as those of acarbose monotherapy. Next question, where cost and consequence measure equality in appropriate physical units, for example like hours, nursing time, number of physical units, lost workers, or gain life years? The answer is usually yes, since there is clinical scenarios for the patient with type 2 diabetes mellitus with different body weight, and there's also the initial dose for each patient. And for time 2, we can see the annual treatment cost of metformin and acarbose in patients with type 2 diabetes mellitus. And in table 2, we can see that there is lowest and also highest annual treatment both acarbose and also metformin. There is also the cost differences between both of them and also saving in annual cost in percent between both. Next question is where the cost and consequence value multiply. The answer is yes. We can see from the literature there are annual average treatment cost of metformin and acarbose at the base case, and also annual average treatment cost of metformin and acarbose in different scenarios. Next question, where cause and consequence adjust for differential timing. For example, like there's also question, was there any justification given for the discount rate used? The answer is no, since the literature said that there is no cost discounting was applied because all costs were measured in a period of 1 year. Next question is, was an instrumental analysis of cost and consequence alternatives performed? The answer is yes. We can see from the table 2, there's annual treatment cost of metformin and acarbose in patients with type 2 diabetes mellitus. Next, was allowance made for the uncertainty in the estimates of cost and consequence? The answer is yes. We can see from the literature there are estimation of the cost, base case identifications, and also sensitivity analysis. Next question is, did the presentation and discussion of the study result include all issues of concern to users? We will see at the next slide. Okay, based from the literature, there are some sentences that say it. First is in the context of current health policy, with more and more government trying to limit the escalation in health expenditure, there is an increasing need to find medical treatment strategies that are as effective but less costly. And there is also a sentence that said that in economic evaluation, it is difficult to accurately measure the study variable, and each medication therapy may bring different treatment costs when applied among different population or medical institutions. So therefore, it is important to verify the effect of basic assumption on the study result. And it is there is also sentence that said to consider only a single monotherapy for 1 year. However, in clinical practice, because of the complexity of diabetes, drug combination therapy it is common, and patients may switch drugs, which can have an impact on the cost over a long period. More complications related to diabetes, including microvascular and also macrovascular disease that may occur, which can also add treatment costs. Okay, here's the reference that I use. Thank you for watching, and Assalamualaikum warahmatullahi wabarakatuh.